Anchovies are often praised for packing an impressive amount of nutrition into a very small fish, and in culinary terms, they are valued as much for their intense umami flavor as for their nutrient content. They provide omega-3 fatty acids that support cardiovascular and anti-inflammatory pathways, and when eaten canned with the bones, they contribute meaningful calcium and phosphorus for bone health. They also supply protein, vitamin D, selenium, and B vitamins. Despite these advantages, anchovies are one of the most problematic foods for people with gout or chronically elevated uric acid, and their risks are frequently underestimated because the portions appear small and the fish itself is seen as healthy. The primary issue is their extremely high purine density. Small, oily fish such as anchovies, sardines, and herring concentrate purines in their tissues, and per gram they rank among the highest purine-containing animal foods commonly eaten. When these purines are metabolized, they are rapidly converted into uric acid. For individuals who already struggle to excrete uric acid efficiently, this can lead to a sudden rise in blood urate levels. Anchovies are therefore consistently listed among the top dietary triggers for gout flares in clinical guidance and patient reports alike. What makes anchovies particularly risky is how easily they can deliver a large purine load without feeling like a large serving. Because they are often used in sauces, dressings, pizzas, pasta dishes, or eaten straight from the tin, it is easy to consume more than intended. Purines are also not reduced by cooking or curing, so salted, canned, or oil-packed anchovies retain their gout-triggering potential. In fact, concentrated products such as anchovy paste can deliver a high purine dose in just a spoonful, making them especially problematic for sensitive individuals. Another layer of risk is that anchovies are commonly paired with other gout-promoting factors. They are frequently eaten in salty, savory dishes that encourage fluid retention and dehydration if overall water intake is low, which can impair uric acid excretion by the kidneys. Anchovies are also often combined with alcohol, especially beer or wine, in social or restaurant settings. Alcohol independently raises uric acid levels and reduces renal clearance, amplifying the impact of purines from anchovies and increasing the likelihood of a flare. Although omega-3 fats are often discussed for their anti-inflammatory benefits, this does not neutralize the uric acid spike caused by anchovies. While omega-3s may support general cardiovascular health, they do not prevent purines from being metabolized into uric acid. For someone with gout, this creates a misleading situation where a food with anti-inflammatory properties still triggers inflammation through a different biochemical pathway. This is why many people with gout experience attacks after eating anchovies despite otherwise following a healthy diet. From a practical standpoint, anchovies are best avoided entirely by individuals with active gout, frequent flares, or persistently high uric acid levels. If they are used at all, they should be limited to tiny amounts as a garnish rather than a primary ingredient, and avoided completely during and immediately after a gout flare. Even then, tolerance varies widely, and some people find that any amount is enough to provoke symptoms. Keeping a food and symptom log can help identify personal thresholds, but caution should remain the default approach. The nutritional benefits of anchovies can be obtained from safer alternatives. Omega-3 fatty acids can be sourced from fish lower in purines, such as salmon in moderate portions, or from plant sources like flax seeds, chia seeds, walnuts, and algae-based supplements. Calcium needs can be met through low-fat dairy, fortified plant milks, leafy greens, and tofu set with calcium. Flavor depth can be added to dishes using herbs, spices, mushrooms, fermented foods in small amounts, or umami-rich vegetables, reducing reliance on anchovies as a seasoning. In summary, anchovies are nutrient-dense and flavorful, but for people with gout or elevated uric acid, they represent a high-risk food. Their very high purine concentration, ease of overconsumption, and common pairing with alcohol and salty foods make them a frequent trigger for gout flares. Treating anchovies as an avoid or minimize food and choosing lower purine alternatives is a safer strategy for maintaining stable uric acid levels and protecting long-term joint health, even if it means sacrificing a small but intense